Welcome to the deep dive. So you've brought us some really interesting material this time. It looks like it's focused on the Department of Health and Human Services, HHS.
That's right. And specifically, some shifts that are reportedly happening under the new leadership there.
Right. HHS, that's the umbrella, isn't it? Covering agencies like the CDC
Yep, Centers for Disease Control and Prevention.
and the FDA, the Food and Drug Administration. So pretty crucial stuff for, well, everyone's health.
Absolutely. And the sources you shared, they point towards some, let's say, potentially big changes within this really key part of the government.
So our mission here is to basically unpack that, right?
Mhm.
Understand what these reported changes are based on the reporting you sent over.
Exactly. And try to figure out what they might actually mean. There seems to be a bit of a tension highlighted straight away.
Yeah, I saw that. Concerns about like suppressing health info versus the official line being about clear, concise communication.
Right. And you mentioned wanting to get the key info quickly, but, properly. So we'll try and pull out the most important bits without getting bogged down.
Perfect. Okay, so where do we start? The reporting kicked off with the comparison that really caught my eye. US versus EU regulations.
Yeah, on things we use every day.
Mhm.
Food, cosmetics, that kind of thing.
And there was a specific number that jumped out.
Oh, yeah, the cosmetic ingredients one. It's
Yeah.
pretty stark. The source, The Guardian, I think it was, mentioned the EU has banned or heavily restricted over 1,300 ingredients.
1,300, okay, and the US
So that's 11.
11. Wow, okay, that's a massive difference.
It really is. It highlights a fundamentally different approach, doesn't it?
It does. And it reminded me of that story, about the trade talks with the EU,
Mhm.
where the Europeans apparently raised concerns about U.S. food quality, things like chlorine chicken.
Right, which has been banned in the EU since, 1997?
Yeah, and hormones in meat, too. So you see this sort of proactive stance in Europe.
Exactly. The reporting kind of paints this picture of a European sentiment towards cleaner living, maybe. Perhaps less reliance on pharmaceuticals because of stricter regulations up front.
And of a preventative approach through regulation.
Kind of like the burden of proof seems different. In the EU, maybe more prove it's safe before you use it. Whereas here, often it's prove it's harmful before we ban it.
Which has huge implications for what we're exposed to every day.
Definitely. Though it's fair to say the source material you shared actually seemed to agree with the general idea of making America healthier, maybe regulating food more.
Right. So the issue isn't necessarily that goal. The focus seems to shift when it talks about what's reportedly happening inside HHS now.
Precisely. So building on that idea of potential shifts, the reporting then gets into some pretty dramatic internal changes, starting with, firings.
Ah, yes, the 10,000 number. That's a lot of people at HHS.
It is. And there's this detail that some might even be rehired, suggesting the cuts were maybe a bit haphazard.
Raises questions, definitely. But the core concerns seem to be elsewhere.
Yeah, the reporting really zeroes in on the alleged misuse of the HHS press operation.
Okay, maybe just explain briefly why these press offices are so important. They're not just PR, right?
Not at all. Think of them as the translators, really. They take complex science from CDC, FDA, all those experts, and turn it into clear information for doctors, for the media, for the public. Life-saving stuff, often.
So they're a crucial link.
Absolutely. And that's why these allegations in the reporting are so, concerning. It's claimed this communication arm is being used to, boost the profile of the head of HHS.
Okay.
Maybe take credit for things done previously, and the most serious bit, potentially spreading disinformation.
Disinformation from HHS. That's a heavy charge. And how are people inside reacting, according to the reports?
Well, it details this supposed secret meeting. Press officers getting together because they were reportedly worried
Worried about what specifically?
about having their names attached to information they believed wasn't accurate. Basically, protecting their professional reputations, their integrity.
That speaks volumes, if true.
It does. And there's an irony flagged in the reporting, too. The current HHS head, RFK Jr., has previously been very vocal about, supposed censorship at HHS, complained about it.
Right, I remember that.
But now the accusation is that he's the one tightly controlling the information flow out of the department.
So how is this control supposedly happening? What does it look like?
The reports talk about communication bottlenecks, basically needing approval for everything going out, especially on complex topics.
Which would slow things down, obviously.
Massively. Getting vital health updates out quickly becomes much harder.
And it's not just speed.
No, there's also this reported preference for really short statements,
Yeah.
like 2 sentences short.
For complex science, how does that even work?
Exactly. You lose all the nuance, all the important context. Imagine explaining vaccine data in 2 sentences.
Yeah, tricky. What else?
Selectivity in responding to the press. Reports of journalists just being ignored or getting minimal, unhelpful answers.
Which means stories don't get reported properly or deadlines get missed.
Right. And one source, Axios, I believe, even reported the White House felt it had to set up its own sort of parallel press operation.
Because HHS wasn't responding?
Apparently. That's a pretty striking claim, suggesting a real breakdown if accurate.
Wow. Any other details on this alleged control?
Yeah, small things too, like supposedly removing phone numbers from press officers' email signatures, making them harder to reach.
So creating distance.
It paints that picture, yeah, of trying to manage and maybe restrict information flow quite tightly.
And there was a direct quote from someone at the FDA.
Yes, quite alarming. This source claimed they were pressured to say things that weren't, quote, true, and that routine scientific info was being deleted.
Deleted? Like what?
Things like updates on red dyes, bird flu info, food regulation details, stuff that would normally just go out.
Okay, if true, that's very serious.
Yeah.
Interfering with routine scientific communication.
It really is. The potential impact on public trust, on people making informed health decisions,
Yeah.
it's profound.
Of course, we need the official response, too. What does HHS say about all this?
Well, the reporting includes a statement from an HHS spokesperson. They called these changes business as usual,
Business as usual, meaning?
meaning the goal is just to provide concise, accurate information and promote the agency's work effectively.
Okay.
The spokesperson also stressed HHS's commitment to transparency, mentioning they post scientific data online and ensure factual accuracy in communications.
So a direct contrast to the concerns raised by the internal sources.
A very clear one, yes.
Now, there's another piece of context the reporting brings in, which feels pretty relevant here. RFK Jr.'s past stance on vaccines.
Right. And this is crucial background, isn't it? The reporting mentions his history of pushing unproven theories about vaccines, things widely debunked by scientists.
And it connects this to real-world consequences, doesn't it?
It does. It specifically brings up the tragic measles outbreak in Samoa.
Oh, yes. Awful situation.
83 deaths, mostly very young children. And the reporting notes his reported involvement in an anti-vaccination campaign there prior to the outbreak. It really underscores the potential dangers of health misinformation.
A very stark reminder, but the reporting also mentions something more recent, a shift.
Yeah, interestingly, it notes the current measles outbreak in Texas,
Yeah.
and that RFK Jr. has, apparently, recently walked back some of those previous claims and actually urged vaccination.
Really? Okay, so that adds another layer of complexity.
It certainly does. It makes you wonder, it raises questions about consistency and what information people can expect now from HHS leadership, given that history.
So wrapping this up then, for our listener, what's the main takeaway from digging into these sources you shared?
I think the core thing is that the material raises some really significant questions. Questions about transparency, about the free flow of essential health information from HHS under its current leadership.
There's that tension we mentioned at the start.
Exactly. A real conflict between the concerns coming from inside the department, as reported, and the official HHS line that everything is normal, just focus on accuracy and promotion.
It really highlights why public scrutiny of these agencies is so important.
Absolutely. Keeping an eye on how public health institutions communicate is vital for everyone.
So maybe final thought for people to chew on. Given how much we all rely on accurate, timely health information,
Yeah.
I mean, think about the last few years.
Mhm.
What are the potential long-term implications if these reported changes at HHS are actually happening? Putting aside politics, just thinking about the impact.
Yeah, what does it mean for public trust? Trust in science, trust in these institutions, and ultimately, what could it mean for our actual health?
Definitely something worth thinking about. We'd encourage everyone listening to keep exploring these issues, look at different sources, and, form their own informed opinions.